Okay. Hi, everyone. My name is Dr. Swati Chanani. I'm a child and adolescent psychiatrist at MedStar Georgetown University Hospital. I work a lot with adolescents and young adults, and I spent some time working in schools, primarily in high schools. And so I'm going to be talking a little bit today about working with military families who have experienced grief and loss, particularly in the school setting. So really excited to talk about this subject because I think it's very important. Um, so just some things I want to make sure we cover today. I want to go over some of the impacts that things like death and injury of a parent or a caretaker or a loved one have on children, particularly military children. I then hope we can cover different ways to help children cope with these losses. And then also just want to talk about some red flags on what to look out for that might signal that a child needs a referral to a mental health care specialist to help kind of further process this loss. So I just want to talk a little bit about kind of the scope of what we're experiencing. And the numbers I have here are from a 2010 report. So they're a little outdated, but from that report, there's quite a few individuals that were deployed abroad, over 2 million individuals, and almost half of these were parents. So quite a few children that had parents being deployed abroad. Of those, almost 4,000 children did lose a parent. And sorry, this report was signaled from kind of the time of the start of Operation Ending Freedom to 2010 when the report was published. So just in that time period. And then, over 40,000 had a parent who experienced a significant injury. We have recently, especially with kind of leaving Afghanistan, seen less injuries and less loss. So the numbers are thankfully going down, but this is still quite a big problem that is affecting a lot of military children. So first I want to focus on injury, right? And we see both kind of physical injuries and then kind of non-physical injuries in our parents who get deployed, and then they're coming home, to their children having to process their injury. There again, there's of course the physical things you think of, like, just hurting a limb, resulting in amputation, but we've actually seen a lot of traumatic brain injury as well, and then a lot of PTSD in these parents. And so what happens to your parenting when you've experienced an injury, right? There's a few things that we see. So one, the parent has less time to be with their child, right? They now suddenly have their own physical or mental ailments that they need to take care of. So they might have a lot of doctor's appointments. They might have physical therapy. They might have other things that are taking up their time that otherwise might have been spent with their children. So they're kind of less available just in terms of time, but they may also just be less physically available, right? If a parent has experienced an amputation, and let's say prior to that, part of how they bonded with their children was playing sports and running around and being active, they may no longer have the same ability to do that, and how that looks may change. So the way in which they bond and relate to their children is going to be different because they now may have certain physical or other emotional limitations. They might also become a little withdrawn because they, are experiencing a pretty significant change and loss themselves. And so it might be hard for them to be completely emotionally available for their children because they're going through their own processing of their own loss. And this might affect their personality, especially if there's been some kind of traumatic brain injury on top of it. They may be, less joyful the way they used to. They may be less fun. They may be more irritable. That's something we see a lot with traumatic brain injury, is increased irritability. And that may, inadvertently come out in their interactions with their children. Again, with, traumatic brain injuries, there could be cognitive changes, right? Their memory might not be as sharp. They might not be able to think as clearly. For anyone here who has a kid, it takes a lot of frustration tolerance to be able to manage your children sometimes. And that might have gone down a little bit with the injury. And so their frustration tolerance might go down. They might be just less equipped to handle the daily frustrations of parenting, and that could come across on their children. And then there's often a partner, right? That wasn't the person who got injured, but is now managing their partner's injury. And there have been studies that show the vast majority of even the non-injured parent report that there have been changes in how they parent their children, and that they have experienced quite a bit of stress as well, just in managing having a partner who is now dealing with an injury. Right, for that parent, they are managing their partner who has had major changes. They're having to take on new roles as a parent. They're having to, probably provide a lot of kind of guidance and education to their child, and so it's changing how they're interacting with their children. Um, which kind of leads to, like, yeah, it changes the family dynamics as well, right? There may be different roles now that the two parents play. All right, so let's say prior to the injury, dad used to drive Timmy to soccer practice every Saturday. Now dad can no longer drive because of his injury, so now mom's doing it, right? There's, sometimes these slight changes in roles can be really impactful for children, especially younger children. So, different parents might start doing different things just because of necessity. And that could definitely put a strain on the relationship, right? Um, the the kind of a two-parent system, right? They might start to think differently about, why am I having to do all of this? They might start to feel strained. Again, the vast majority of folks who experience an injury, they say it leads to marital conflict after the injury. We also see higher rates of interpersonal violence and higher rates of child abuse in military families that have experienced an injury and are coming home to grapple with that. And if we think through, the previous slide and the ways an injury can affect a person, you can kind of see how, right? They're just not, they're still in the process of dealing with a lot of physical, mental, emotional changes, and then it's going to come out in just strained and sometimes maybe, abusive relationships. And so they're really there's a lot of things that I think we can really focus on here that the children might need support in. And so I'm going to kind of shift into talking about how children experience loss and, like, grief when there is a death, before I talk about kind of how, what as educators you guys can do to help, and other signs to look for. So death is a really big deal to children, right? It's something that they are still learning what death even means, right? They don't have the same understanding of death and life and permanency that adults do. And so you're going to see a lot of different responses to death. And some really common ones that, might not be the way adults respond is children, especially younger children, might think death is reversible, right? They watch cartoons, right? And cartoons, someone gets knocked over by a car and then they just get back up. And so they think death is reversible. And it might take a little bit of time for them to realize that this is something permanent. They could also deny it, right? And just kind of be like, no, mommy's still here. She's just coming back later, right? Even though they do understand what's happening, denial is just a way the brain kind of naturally goes to something that's very difficult. They also might, and this is very common of children across the board, they tend to blame themselves for things, right? They have a very egocentric way of looking at the world. And so anything that happens, they link directly to them. So they might feel that they are somehow responsible for the death, and then feel extremely guilty about that. You might also see some regression. So kids start to act younger than they are. They, might lose skills that they've previously mastered, and they may behave younger, right? A kid that was maybe previously potty trained might start having accidents. A kid that was previously doing really well socially might start to behave kind of a few years younger socially. Very common to have some regression. It's just, right, because performing your skills to the fullest level, right, requires a little bit of brain power, and now they're processing some other things. We might also see somatic complaints. So what I mean by that is a lot of like stomach aches, headaches, things like that that are not otherwise explained by something medical going on, but they might just feel sick to their stomach, you know, feel like they have headaches. Those are probably the two most common ones, because they don't know how to express their emotions. And so those emotions are building up, they're building up. You're getting all the like physical things that happen in your body when you experience strong emotions. And they obviously notice like those physical kind of side effects of the strong emotions, right? And so it's not that they are, saying they have a stomach ache when they don't, or saying they have a headache when they don't. They're really experiencing those physical feelings, because they don't know how else to process their emotions. And then, it's also very common, and this I think will often, sorry, excuse me, worry people. They might see or hear the person who's passed away. And that is not that, they're like now having hallucinations, but it's very common that they might think they hear mom's voice at times, or think they see her. And to a certain degree, that is normal and normative, and should not be something that raises too much concern. And some of these reactions to death that I'm talking about will vary age by age, right? So a preschooler will react differently than an elementary schooler, than a middle or high schooler, right? With the younger kids, right, where we might see a lot more kind of separation anxiety with caretakers that are still there. And they might have, again, a lot more regressive behavior. School-aged kids, we could see that they start asking a lot of questions, and they're very curious, they need to know a lot, or they pretend like nothing is happening, right? And they kind of go into the denial mode. They might also have a lot of separation anxiety and just kind of higher levels of anxiety in general. And again, this is really where we'll see like the somatic complaints, and a lot of the like, I don't feel well, my stomach hurts, my tummy hurts. As kids get older, they might react in more externalizing ways. So we might see more risky behaviors, right? Them taking risks in terms of substances or relationships, right, that they weren't doing beforehand. They might not want to talk about it, right? It's hard at this age to want to talk about your feelings. So when you're thinking about how a student you're seeing is reacting to death, also thinking about their age, and is this an appropriate response for their age? So as educators at the school, what's your role when a family member of a student passes away, right? Or there's a significant injury. So one is to communicate to other parents, right? And this serves a few purposes, right? You want to just tell them what has happened so that they're aware. You also want it as a chance to kind of dispel any rumors, right? People talk about a lot of things when something like this happens. It's really important for people to have the facts so that people don't gossip and spread other things that are rumors. You also want parents to know about, what kind of signs they should look out for in their children that might indicate that they need more support, and then provide resources to those support. So, if your child needs XYZ, here's some places to reach out to. Same goes for teachers, right? You want to provide education. It's great that I think that you guys are all here kind of listening to this, right? Provide education to the teachers on what to look out for in their students, how to approach their students, and then what their role is and where they can approach resources. You definitely want to make sure you have those resources, right? So having a partnership with somewhere where you can make easy referrals to mental health professionals. The military also has military life counselors through the DoD that can be really useful. So knowing if you have, particularly a lot of military kids, right? How do I access those military life counselors to have those resources? And then just paying really close attention to any students who've previously experienced a loss, right? Having someone else who has experienced a loss can be re-triggering for someone who's had it previously. So just making sure you're kind of seeing what they're doing, if they miss a few days of school, kind of reaching out, making sure they're okay. and kind of, you know, what do you do to help them cope, right? Like this is, you're like, what's my role here? Like, what do I do? Part of it is just being there and being a stable person that they already know and trust, that they can talk to, right? That they're like, okay, I have this person that I know. I can go to them for in this trying time, right? You want to maybe just kind of check in with them. Um, and say, and we'll talk about a few specific things to say, but just check in with them, kind of see, are you doing okay? What's going on? You want to be very straightforward and use very clear language, um, saying, I know mommy's no longer here. How are you doing? Right? Rather, sometimes kids might not pick up on veiled references and it might confuse them more. Be straightforward and be clear. And being as, kind of to the point, but still being very kind and non-judgmental, right? Being very non-judgmental here and however they're feeling, if they say, I'm not upset at all and I'm more worried about, my breakup, not being judgmental of that and really just validating anything they're feeling, helping normalize what feelings they're having. So saying, I think this happens to a lot of people who experience similar things. And then just keeping in mind any kind of cultural differences or any kind of developmental differences that might be influencing how this child is coping. And if you're not sure about those, even asking them or other, family, like how would this normally be dealt with in your family? Um, and then the last point on this, I think, is really important: maintaining their routine, especially in school. Right, school is such a often safe place for kids to come to, right? It's relatively the same every day. They know what to expect. They know who's there, maintaining that routine as much as possible. So they have that kind of steadiness in their life when other things are not as steady and not as routine. So really helping maintain that safe place that school is. Right. So things that you can say, right? Tell me about what's going on at home. Right, that is a little broad, but I think that opens it up for them to tell you what they're going through, right? um Saying, when someone important dies, some kids have questions about death. What questions do you have? Right, so that is very to the point, very specific, and gives them, both normalizes it by saying, when sometimes someone dies, kids have questions, and then opens it up. What are some ways in which your family is dealing with this, right? And what are some ways your family normally shares feelings, to know what is kind of culturally and normal for that family. And then asking, just tell me how you're feeling, right? It might seem a little to the point, but that really gives them some time to open it up. Maybe asking, thinking about kind of how roles change. What are some extra things or tasks you're having to do at home? Um, because maybe they're now having to take care of some younger siblings, and that's creating a lot of stress. So giving them an option to talk about that. And then really also, asking, this kind of helps them remind them about their support, right? Who are the people that help support you through this difficult time? Just asking that question might help remind them, or help them kind of, if they're like, I don't know, but helping them brainstorm who's in their corner, who's in their camp, who can support them through all of this. So what should you look out for that is like, maybe this kid needs a little more help and I need to refer them to a professional? If we're really seeing a loss of interest in like daily activities that they once enjoyed for a long period of time, right? So it's been a few months and they still don't want to go to recess, and they used to love recess. They don't want to play basketball. They used to love playing basketball. They used to love reading, and they're no longer doing that. If that's persisting, that's a sign that there may be something kind of more complicated going on, and they might need help. Um, Again, if there's persistent changes in sleep or appetite, there will of course be some changes in sleep and appetite after something like this. But if these are really sticking around and they're either sleeping too much, and you see them sleeping in class kind of consistently, or they're telling you they're not sleeping at night, and again, if you notice they're eating too much, not eating enough, those are signs that they might need some extra help. Um, if they're, again, there's kind of this persistent fear of being alone, right? They don't want to, right? So not just kind of some separation anxiety, but they really are scared to be alone, and you're picking up on that. That could be a sign that they need to be referred. If we see regression that lasts much longer than a few months, right? So like some regression is normal, but if they're acting much younger than they should be, and it's going on way longer than a few months, right? Um, if they are, and some of this is normal, but again, if they are excessively imitating the person who has passed away, that could be a sign that they need a little extra help. And kind of along those lines, after they lose someone that they die, it is somewhat normal for children to say, oh, I wish I was with mommy, or I wish I was with daddy. That's not necessarily an indication of suicidality if they say it a few times, but if they keep saying it, it might be worth them talking to someone to really know what they're getting at, and to see why they're feeling that way. If they're a kid that's normally social and they're really withdrawing from their friends, again, for an extended period of time, that's concerning. Um, and then if there's a significant drop in school performance, right, or they're not attending school regularly, and again, that goes on for more than, a few months, then that's also a concerning sign. The other thing I just want to point out, right, is that we also, you're going to work with children that have experienced other types of trauma before this loss, right? Children are not clean slates, and they may have experienced other trauma, which then gets in the way of them processing the death. And right, we then call that like childhood traumatic grief, right? Because their trauma is getting in the way of them processing their grief, right? So they're not able to process those emotions, and they just kind of don't talk about it, right? They really deny what happened. They really cannot process it in any way. They're not able to have, part of processing and helping and moving on from death is having positive remembrances, right? So doing things to think about your positive memories with the parent or the loved one who passed away, and having ways to honor them. And they're not able to do that. They only have the negative, and they only have the loss that's in their head. Right? They're not able to do, part of also the process of grieving is to think about what life means and what death means, and put all that together, and they're just not able to do that. So when you see like grief that doesn't look the way grief should, right, it might be because there is a kid who has experienced other types of trauma, and then we just need to hone in on that, and that is a great time to have them reach out for more professional help, right? To say, let's talk to a therapist, let's talk to a psychiatrist, and let's help get you on track to help process this. Um, so that's about all I wanted to cover today. I know it was a kind of a lot of information. I think kind of my sticking points are that, we're going to have a lot of children that are going to experience different types of loss and grief due to either injury or death in a parent. And your role as an educator is to be there for that child, to provide that continued support, consistency, routine, and just give them a place to talk if they need it.